Dr. Jyothi. She's a medical director at Ferty9 Fertility Center. She's joining us all the way from Sikandrabad, Hyderabad, basically. So thank you so much, Dr. Jyothi, for being a part of our World Breastfeeding Week awareness.
Yeah.
So
Thank
quickly
you for
to you,
this opportunity as well. Thank you.
Thank you so much. Quickly to you to understand what are the benefits, especially for the new mom and to the infants of breastfeeding.
So I would like to start my comment by saying, you take care of the newborn today. It will nurture your tomorrow. So we have a responsibility to take good care of the newborns because these are the people who are going to be the citizens later. So having said that, when it comes to about breastfeeding, we are very happy and privileged to have a breastfeeding week, the whole week of August 1st to 7th. 120 countries are enrolled in this. It is led by WHO and UNICEF. So now about why is it so important? The awareness, creating the awareness for breastfeeding is so vital because if you see lack of awareness, before people used to think that breastfeeding can cause issues in the contour of the woman's body, but this myth has to be solved. You know how many benefits we have with the breastfeeding, starting from the mother itself. Once a mother starts breastfeeding, that skin to skin touch with the body of the baby and the mom releases a happy hormone called as oxytocin. And if you have to tell about this beautiful hormone, one day is not enough, but to make it very brief, this is called as the hormone of love. Having said that, it has effect both in the women's physical body and the mental body as well. So to start off with the physical body, once the lady, she sees the baby in her hand, it's a lifelong commitment for her. And end of the day, she has to take care of herself also. So challenges start from then. So this oxytocin hormone is scientifically proven that during the early, part of newborn handling the baby, we call it as puerperium. The uterus has to go back to its normal shape because when they carry the baby, it bloats and it becomes 40 centimeters. The normal size is 6 centimeters. For this contraction, oxytocin plays a very major role. So having said that, research has proven, science has proven this breastfeeding helps in controlling certain issues like cancer of ovaries and even breast cancer chances are reduced. And of course, something what a woman likes is to shed her fat and weight once she's a mother. So this hormone perfectly well helps in decreasing the weight as well, because when the woman is feeding the milk, lot of calories are also used in her body. So indirectly it helps her in controlling her weight. So having said that, what about the mental status now? Physical body is taken care of. The mental status, we know the hormone oxytocin is a contentment hormone. You are contented. You do any physical activity, say suppose you do a sport, initially you will have the dopamine rush, adrenaline rush. Then after few weeks, you are contented with the release of oxytocin hormone. For a woman when she breastfeed, so nature is so good that it releases in her body and it takes care of relationship issues also. They say it's proven it takes care of bonding, relationship issues, and even it acts as a stress buster by decreasing the cortisol level. So it has wonderful aspects for the woman herself and the baby.
So Dr. Jyothi, like having said that, as you were talking about the benefits of breastfeeding, now we are seeing the rise of NICU baby. Like for example, for my case also, so I had a premature delivery, and my child was in NICU for almost 3 months. So especially for the mothers who are having premature deliveries, how important it is to have a lactation center. Though of course, a lot of awareness have now started because of like giving the mother's milk. So and now a lot of mothers are not able to also get the breast milk because they are delivering very soon. So what is the importance of lactation centers that we'll talk about? Since you have mentioned how important it is, not only for mother but also for infant. So how important is lactation centers now when we have premature deliveries?
Yeah. Perfect. So now, importance of breastfeeding, when we create the awareness, everybody knows it's so important. So there is a spectrum of patients where we see some ladies have excessive milk, some
True.
ladies,
True.
milk production is very less in them. So
Yes.
to maintain the balance, so it's a very beautiful concept called as lactational center has come up, and there is milk bank, like how we had blood bank initially, we have milk banks. So this is a place where most of in all centers in all the cities there is a facility for a milk bank. So what does these milk bank do? Basically, there is an agency where they store the milk. There is a way they get the milk from the mother who is producing it more, store it at minus 20 degrees. So before storing, there is a process. They screen, they make sure it is, aseptic methods are there for storage, and it is available for women who has a decrease in milk production, or when they need. And sometimes the mother, especially for working women, when in the morning time they're busy working, and evening when they have to feed the baby, even for those people arrangements are made in this centers. So just to go one point ahead, there is in our own country, there is a human milk production bank in our country. So it is basically an organization where people understand, and the importance of the breast milk, the storage, everything has been explained and awareness has been created.
Yes, I remember because during my, like, when my daughter was in NICU, we required the mother's milk, and it was at that time the Fortis was actually the milk bank present in our city. So I know the importance, that especially for a mother seeing the baby, and how important the mother's milk is. And at that time, I was also, because of a lot of stress, lot of hormones, and it was a 7th month delivery. So
Oh,
that, so by, like, because that's the reason that not I had a very low milk supply, but of course only for 15 days I had. So I remember that how important those milk banks, and they came for a rescue. So, and
uh,
as you have mentioned that now a lot of women are working also, and
yes,
especially with you, I'm sure, because as a part of work that you're doing, there are a lot of IVF pregnancies also. So a lot of mothers have this mindset also. So does the IVF delivery or IVF pregnancy affect breastfeeding also? Or
yes.
because sometimes we're conceiving of second child also through IVF, and the first child is having, like, is on breastfeed. So how
Yes.
like, what is this myth?
Scientifically, the breast milk production for a woman who is undergoing IVF is not affected at all. But having said that, most of the IVF women's, there are chances of them to go for a preterm delivery. Little early, as you told, can happen. It's not like most of the time, some of the time it can happen. So in fact, these women's, after many years, they are becoming mother now.
Dr. Jyoti, I think we've lost your audio. Your audio is not coming. We just check that.
So,
No, it's fine.
yeah, so it becomes very important, and the importance of colostrum, that is the first 3 or 4 days of milk production, which has more protein and immunoglobulins to fight the germs. So these 3 days are very vital for the women to feed the baby. So for IVF women especially, because we keep seeing them throughout the care, maternity care, we can, there is a guided antenatal program for them. So breastfeeding orientation and awareness is created at the antenatal care itself. So especially we also request them, awareness is created for self-examination of breast. Sometimes there can be a retracted nipple. There is a mechanism for them to also deal with that. Also evidence says the first week is very important for the babies, especially when there is prematurity. So all these emphasis will go to the IVF mother, where it's not only the pregnancy, it is the baby, and the healthy baby is the concept what we are looking for.
So, and coming to the next one, only be related to your work, that whether, because there are a lot of myths that because if you are breastfeeding, you can't, like, you cannot conceive. So is it a myth or is it a reality?
About this, I will just give you a proper, scientific reply. So if you see what happens during after the delivery when the mother is feeding the baby, hormone oxytocin is released in the body. So any woman who becomes pregnant, she doesn't want to conceive for some time, at least. So nature takes care by releasing this hormone. Somewhere this oxytocin will decrease estrogen in the body and little take care of ovulation. It causes little anovulation. But having said that, it can't be used as a contraceptive method because we know many women comes and talk to us about this. I've been feeding the baby, I just became pregnant, because it is a challenge to deal again. So important to understand and to create awareness is, of course, breastfeeding will act help in decreasing ovulation, but it doesn't act as a contraceptive method. So if they don't want to have a baby, important is to have, they have to use another contraceptive method to prevent pregnancy.
So thank you so much, because I know because of the platform also, because there's a lot of myth which keeps on happening, because on the platform
Yeah.
also we keep on seeing such kind of query.
Yeah.
So thank you so much for joining us today. But before we end this session, since we are talking about World Breastfeeding Week, and this year the theme is about the closing the gap and giving the breastfeeding support to all. So what is the role, do you think, of a community as a family? And also, if we talk about the organization, since now women are working, what's the role of all of us when we talk about the support to breastfeeding, especially a new mom?
Yeah. So it starts from the mother itself, herself, the mindset change is very important. Example, before maybe some 10 years before, I used to see breastfeeding was like kind of going outside and breastfeeding. They used to avoid going out. Now she should also understand that there are, she can take her routine life and there are people to support her, and the confidence in her should also raise to the standards now. And then next is the immediate family. So even family support is very important, that continuing breastfeeding for 6 months, exclusive breastfeeding should be supported, and taking it forward for 2 years. That's what they say. Even a working woman, she should not think in a way that, oh, I should stop feeding and then I should get back to my routine. So encouraging them, they need a lot of family support for this aspect as well. Next, going ahead with the society. If you see the society now, you see any mall or airport, anywhere, you have a dedicated room
True.
for lactation.
Yes.
Even in hospital, we have a place for lactating mothers. So that awareness has already set in the society. So it's easy for women to continue feeding till the the rightful time for the baby. And creating awareness, as you told, bridging the gap is the concept of this year for the breastfeeding. How do we bridge the gap? Women who produce more milk will definitely help those ladies who are producing less milk. But this bank, this awareness is so important.
True.
End of the day, helping others is always a concept for a human.
Yes.
So this is another way of bridging the gap and helping the society as well. So thanks for people like you who are creating this awareness. So whoever listens this can also understand there is a place called as breast bank, where they can even, like, not only donating the blood, donating milk also is of value, and it definitely helps people who have less milk production.
Thank you so much for sharing this view, because I think this is the key takeaway from today's. Because as women, we all have to come and support. Just ending the session with a small story of my own self. Because as I told that my daughter was into an ICU, and there were the community mothers who came. So initially they were the milk banks with whom we got the milk, but then the community mothers who were staying nearby to the hospital, they came together, and they talk to their friends, and those networks actually came forward, who were the new mothers, because it was said that the doctor said it was only a new mom with a 3 month old baby, not more than that. And we got that support. Thankfully, my daughter, though she was in NICU, she got that mother's milk through other mothers. So the very beautiful point that you have mentioned today, that yes, as women we have to come forward and we have to support, and that's how we can bridge the gap. And that's how the mothers all across the nations will get the right support. But thank you so much for joining us, doctor, and sharing us the expertise, because I'm sure a lot of myths have now, people who have listened to us and who will be listening afterwards will be debunked, especially as you have mentioned that the pregnancy and breastfeeding things that we would be discussed, and how the importance of lactation centers is the need of the hour. But thank you so much for today and joining us.
Thank you. Thank you for having me and giving me this opportunity. Thank you.
Thank you. Thank you all of you for joining us. And throughout this week, we'll be having the sessions on specially focused on breastfeeding awareness. So stay tuned because some experts will be joining us. So this was Dr. Jyothi who joined us all the way from Hyderabad, basically from Sikandrabad, and she is the medical director at Ferty9 Fertility Center. Thank you so much, Dr. Jyothi.
Thank you. Thank you. Bye bye.